Welcome to the DNA podcast. In this episode, we uncover India's growing mental health crisis, with nearly 150 million people needing timely care, meaningful support, and active intervention. Understanding the scale of the issue is the first step toward building a healthier and more supportive society. Mental health is no longer a hidden issue. Stress, anxiety, depression, financial pressures, changing lifestyles, and the breakdown of traditional support systems are affecting millions of people across India. Yet, despite its growing impact, mental health continues to be misunderstood and surrounded by stigma. According to the National Mental Health Survey, around 11% of Indians live with common mental health conditions such as depression, anxiety, and bipolar disorder. That translates to nearly 150 million people who need awareness, counseling, medication, or other forms of support. The survey also found that people between the ages of 40 and 49 are most affected by stress-related and psychiatric disorders, while substance use disorders are more common among those aged 50 to 59. Women are more likely to experience depression, while alcohol-related disorders are more common among men. Mental health challenges are also more common in urban areas and among lower-income groups. India has been working on mental health care for decades. The National Mental Health Care Act of 2017 strengthened the rights of people living with mental illness and made access to mental health care a government responsibility. Researchers have also studied the emotional impact of disasters such as the Bhopal gas tragedy, major earthquakes, cyclones, and the tsunami. These studies found that strong communities and social support play a vital role in helping people recover. Technology is also becoming part of the solution. Mobile apps and digital tools are helping people with depression, supporting families of children with autism, and making mental health services more accessible, especially in places where professional help is limited. Awareness is equally important. Films, public campaigns, and well-known personalities have encouraged more people to speak openly about their mental health. Their voices help remind us that mental health conditions can affect anyone, regardless of age, background, or profession. But there is still a long way to go. India has fewer than 6,000 psychiatrists for its entire population, making it clear that more trained professionals and community-level mental health workers are urgently needed. Experts also stress the importance of research, stronger government policies, and partnerships between healthcare institutions, universities, NGOs, and local communities to build better mental health care services. The United Nations Sustainable Development Goals also recognize mental health as a global priority. As India moves forward, caring for our mental well-being must become just as important as caring for our physical health, because a healthier mind is the foundation of a healthier life. Thank you for tuning in to this podcast. If you enjoyed this episode, make sure to like, share, and subscribe for more captivating stories from India and beyond.